Good afternoon. I want to provide you a short update on our healthcare preparations to manage ongoing cases of coronavirus in Jersey. So over the weekend, the General Hospital received a delivery of over 100 items of medical equipment that support patients' oxygen levels and breathing in the event of complications arising from COVID-19. There are 3 different types of breathing support in use. Invasive ventilators are used if a patient needs total support with their breathing. Non-invasive ventilators partially support breathing, and CPAP machines support patients with the pressure of oxygen they receive. Jersey's Health and Community Services now has the capacity to ventilate up to 39 patients and to deliver CPAP oxygen support to a further 40 patients. And I really want to thank everyone who's been involved in sourcing these vital machines, ensuring we are well prepared in the event of an increase in the number of patients with health complications arising from coronavirus. And that includes health and community services staff, those in our commercial and procurement teams, and the Ministry of Defence in the UK, who transported the equipment from Telford to Portsmouth. I'd also like to provide an update on our testing and healthcare capacity. From the testing which took place over the weekend and today, we've now tested 2,635 samples for COVID-19 and have received 2,289 negative results and 284 positive results. Of those with positive results, 42% are male and 58% are female. The average age of those who've tested positive is 54. The results of 62 tests are currently pending. 185 islanders have now fully recovered from coronavirus, having originally tested positive. Of those who've recovered, 42% are male and 58% are female, and their average age is 48. 69 islanders are currently being treated in the General Hospital for a range of medical conditions. And of those, the number of coronavirus patients has reduced to 10. There are 128 beds currently available in the hospital, giving us an occupancy rate of 35%. A total of 20 islanders have now sadly died as a result of this pandemic. Of those deaths, 10 were confirmed through laboratory testing as being COVID-19 deaths, and 10 were presumptive coronavirus deaths. A total of 11 deaths took place within hospital care, 9 in the General Hospital and 2 in St Saviour's Hospital. Outside of the hospital setting, 8 deaths occurred in island care homes and 1 within an individual's own home. 7 of those who sadly died were female and 13 were male. 2 of those who died were aged 60 to 69 years, 7 were aged between 70 and 79, 7 were aged between 80 and 89, and 4 were aged over 90. Before I end, I want to highlight that today we launched a confidential survey for children and young people in Jersey to share their thoughts and feelings about the coronavirus pandemic. The address to access the survey is now on screen. This is a collaborative approach between the government and the Children's Commissioner, which will give children and young people a chance to comment on their experiences so that ongoing support can be tailored to meet their needs. And we've had 500 responses from children and young people since launching the survey this lunchtime, and I want to thank them all for their valuable feedback. On Friday at 2 p.m, I'll be leading a press conference where we will set out the phased framework for easing the stay-at-home instruction. I hope that many of you will be able to watch and listen live through social media or BBC Radio Jersey. Thank you for listening. Good night.